Hi, my name's Bill McPhee. I'm the CEO of Magpie Media Inc., your partner in mental wellness. Today I got a question regarding diabetes and schizophrenia, whether people with schizophrenia are more likely to get diabetes or not, or if antipsychotic medication causes diabetes. Now, let me first of all say that I am not a doctor and I'm not giving medical advice, but I'm just sort of giving you my general understanding of diabetes. Basically, diabetes is when the pancreas that is supposed to secrete insulin, but it is failing to do that. So the insulin is not getting into the blood system. And you can have type 1 diabetes, which is also known as brittle. For example, that's where the pancreas isn't really secreting any insulin. My aunt, I can remember her, she was diabetic, and she would go into spells or almost go into a coma and get totally right out of it and not really know what she was doing. And somebody would look at her and say, hurry up, get Aunt Ellen a drink of Coke or something like that. And so the sugar, as soon as she got, almost instantly, she would come back to her normal self. So her problem was that her pancreas wasn't secreting any insulin. That's known as diabetes 1 or brittle. Diabetes 2 basically is where your insulin is not fully cut off, but the pancreas may be secreting not enough of it. So not enough of it, and therefore type 2 diabetes is at issue. Now, type 2 diabetes, though, can be controlled with medication or also by eating properly and getting enough exercise. What happens with diabetes, because you're not getting enough insulin, it could affect your heart, it could affect your eyes, it could affect your kidneys, your liver. Diabetes is very serious because it affects all of those organs that are sort of wasting away. Now, as far as antipsychotic medication and whether it causes diabetes or not, it really doesn't. What happens is that people, because of the nature of the illness that we're dealing with, schizophrenia and say bipolar and depression, because we are inactive, we're less motivated, we have a tendency to gain weight, so therefore type 2 diabetes can occur. In saying that, it can be controlled though. Symptoms of diabetes, type 2 diabetes, can be controlled with proper eating, dieting, and exercise. However, once you have been diagnosed with diabetes, you were pretty well always will be a diabetic. I don't believe that just by catching it and taking insulin or eating properly that you can reverse diabetes. There may be some people that tell you can, but I think the science literature says that diabetes can't be reversed. However, it can be very well controlled though with proper weight and exercise and eating properly. However, again, the nature of mental illnesses, because we become inactive, we sort of gain weight and become obese, which is hard on the system, and diabetes can occur. So antipsychotics not necessarily do create diabetes, but what they do is that because we're inactive and not really exercising and eating properly, there's a better chance of us coming down with diabetes. Now, in the future, diabetes is going to take a toll on our healthcare system because it does cause so many problems, like because of the eyes and the liver and the kidneys and the heart weakens them. But what's important to know is that there's a lot of people out there walking around with diabetes or a high blood sugar that they don't even know about it. For example, you may have, when you wake up in the morning, if you tested your blood, you may have a blood sugar rate of 5, which is normal. After you eat and then test a couple later, you may have it at 8. It may be 8, which is fairly normal. However, there are people walking around with readings of 16, 17, 18 who do not even know that they are affected by diabetes. So that's my answer on that question about diabetes and antipsychotic medication, and whether if the skinny people can get diabetes. And yes, skinny people can get diabetes as well. And people who are in shape, and they may control their symptoms better. So it's always better to eat the right things, exercise, and help to control your blood sugar. If you have a question for me on recovery, please email me at bmcphee@magpiemags.com. Thank you and have a good day.